Two Harvard researchers went around the country asking people without any insurance and a lot of health problems, if they could fix one problem, what would they fix? The answer surprised them. The people without any insurance and a number of health problems chose to fix their teeth. This is the subject of the moral hazard myth, one of my favorite articles by one of my favorite authors, Malcolm Gladwell. To look up the moral hazard myth, check out the New Yorker from 2005. It is still very relevant today. As Paul, Dr. Nacho Goodman, a dentist of 18 years, a practice owner of 15 years, these are the A's that are involved in being a dentist. These are how we feel each day in our dentisting lives. I call it dentisting because it's a verb. Dentisting is a full body experience. Doing full contact arts and crafts on people that don't want to be there, that's dentisting. But what are the A's of dentisting? Sometimes dentistry is very awesome. AATI, always about the impact. We get to change people's lives in the best way. We help them chew with confidence, smile with confidence, and feel better about themselves. That is why those people chose to fix their teeth. Because without teeth that look great and work great, they couldn't find jobs. They couldn't eat nutritious food. People judge them. So dentisting humans like us, we do awesome things and amazing things for people. People should like us better. We're just trying to help them eat. That is one of my favorite things to do. And I'm going to guess if you're listening to this, it is one of your favorite things to do. But being a dentisting human, it's not all about awesomeness and amazingness. It also can be very annoying. What's annoying? Running a dental practice is a little bit like running a circus, where the animals, like this bear, don't try to eat you, just slowly annoy you to death each day. Patients can be and say and do things that are exhausting and ask things that to us as dentists are annoying, like, why doesn't my insurance cover 33 veneers? My sister's insurance covers 33 veneers. And you want to say, you're lying, because first of all, we only have 32 teeth, and your sister is also lying. But what you have to say is, dental insurance, it can be very, very confusing. So can I share with you repeatable word scripts, things you can say? Your dental core, your dentisting core is made of your mind skills, your word skills, and your hand skills. Clinical skills are just as important as communication skills. But in dental school, they're all like, memorize the Krebs cycle and make a mediocre bite rim and wax up a number 9. Things we don't really do in private practice. Why don't they add in some communication? What to say when a patient says, how long will this last? What to say when a patient says, what does my insurance cover? These are repeatable word scripts I'm going to share with you. Because dentistry, dentisting, it can be awesome, it can be annoying, it can be awful, and it can be amazing. That's the life of us dentisting humans. And my goal is just to help make it a little bit better for you. So who is this guy videoing a bear and talking to you? My name is Paul, Dr. Nacho Goodman. And let me start with the now and go backwards. I am currently a 43-year-old dad, dental practice owner, husband, practice broker. Dr. Nacho, I'll tell you more about that in a minute. And human being of Earth that's trying to get through this pandemic just like you. If you're watching this years from now, there was a pandemic in 2020 that's bleeding over into 2021. And it's quite frustrating as a human being and a dentist. So I am a dental practice owner with my brother. I'm very lucky to have my brother as a partner. It allows me to do many different things. We own 2 practices in Mercer County, New Jersey. Our dental team consists of me, my brother, 2 general dentists, a prosthodontist, a periodontist, a GP that focuses on oral surgery, a GP that focuses on sleep apnea, multiple hygienists, multiple front desk team members, and multiple dental assistants. I enjoy working as part of a team. The person I have to thank for that is my dad, who was an amazing father, friend, mentor, and dentist. He had a dental partner. And growing up in the 90s, I wanted to do one of 3 jobs: be a lawyer like Tom Cruise from A Few Good Men, so I could just yell, "You can't handle the truth." Or George Clooney from ER, he seemed very cool. Or a dentist like my dad. To my dad's credit, he never pressured my brother and I into being a dentist, but he always shared with us the value of running a business, being your own boss, and helping people. So I went to Villanova and Penn as part of the 7-year program. I was always one of those younger kids in the grade, so I graduated dental school at 24. So that's the now. Let's start from the beginning. Graduated from Penn at 24, went to the Albert Einstein General Practice Residency Program. I love being part of a hospital system. I love being a general practice resident. I stayed as a chief resident and fellow for 3 years before joining my dad and his partner in private practice. The magic during that time, because success in life is a lot about luck, but don't tell people that, because they don't like to hear that. So say this: success is a lot about good timing. And I had some really good timing because I had an amazing mentor, Dr. William Stewart, who encouraged general dentists to learn to place implants. So I was able to place 150 implants over 3 years. I learned a lot about what I wanted to do in private practice and what I didn't want to do. I thought I was going to be a super GP and do crown lengthening, endo, implant, sinus lifts. As I moved on, I wound up focusing because I like having a team where everyone can focus on what they do best. So, getting back to my story, I then left the Albert Einstein program but stayed on there as teaching, and I joined my father in private practice, and it's a practice in New Jersey that's still there today. And what are some of the practice management tips I can share with you? I thought to myself, if I can make this practice like Best Buy, where people would get more things in one place, I love Best Buy, people would find it convenient, we could enhance our revenue, and we could do more good things for people. So we added an in-office periodontist, an in-office endodontist, at the time an in-office orthodontist. The key to adding in-house specialists in your office is wanting to work with dentists. Unfortunately, the dental school Hunger Games teaches us not to like each other, so it's not easy for us to work together in private practice, but I hope to be part of the solution in changing that. Over time, we acquired multiple other practices in other locations, so being a multi-practice owner comes with a lot of good points and a lot of challenging points. If you want any questions about being a multi-practice owner, feel free to ask me. Along the way, I taught a lot of my first implant courses with an amazing periodontist, Dr. Alex Cho. Taught over 50 of those my first implant courses. Love lecturing on communication, practice management, business systems, stress management, dental implants, and how to buy and sell dental practices. In 2016, I became a dental practice broker and work as a seller broker, not a dual representation broker. If you're listening, dual representation brokerage is nacho nuts to me. It's like saying you are an Eagles and New York Giants football fan at the same time. I don't know how that works. Credit to Rob Montgomery, my dental-focused attorney friend, for that joke. So I'm a seller broker, and then on other deals, I'll help coach buyers. In 2017, dental Facebook groups became popular, and I started Dental Nachos. I love Mexican food. My wife helped me come up with the name, so she now is called Mrs. Nacho. Dreams do come true. I wanted to be a professional NBA basketball player. That didn't come true. But for my wife, Mary, being called Mrs. Nacho, that was her dream. So fortunate for her, that dream did come true. I thought it would be a few hundred people talking about implants and practice management. Since 2017, Dental Nachos, our dental Facebook group, and other social media components, including in-person events when that's legal, has grown to over 30,000 dentists and humans. And I really enjoy running that group. The core mission of that group is, if it doesn't help, it doesn't matter. What can we do to help each other learn, share, and build a community that cares? So I do a variety of jobs in this dentisting world, which just lets me share with you, watching this video, that I have experience and stories in a variety of arenas. Now, us dentists, we often want to know about data. Can you give me the data? Can I have the study? Can I see a bite wing of the bite wing? Could you show me an evidence-based study of the 1980s on procedures nobody does anymore? This may be good for clinical care. This may be good when you're thinking about recommending an implant overdenture fixed versus removable. But it doesn't work out as well for your huge dentisting life decisions. Why? Nobody has done the studies. There are no studies on buying practices of significance. There might be stories, there might be collections of stories. So I want to share with you stories throughout this, and that's why our dentisting core is made up of our mind skills, our hand skills, our word skills, and at the center of it, our heart skills, because we need to create a better dental world for us, our patients, our teams, for the dentists that are in it and the dentists that come after it. there are a number of problems and challenges that we are facing, and my goal is to help make them a little bit better. My goal is to share with you how you could make them a little bit better, and I'd also love to learn from you as well. So, how to succeed in dentisting without really crying is my mission. To help dentists do the following: increase success, decrease stress, and reduce the number of times they feel like crying inside a day.